Basic sexual problems and its remedies. That's the topic that we want to look at today. It is so common in our society, it's a vicious cycle, and we have a doctor and a Nollywood star who are going to look at this topic with us. Stay with us.
A lot of times, our religion preaches that women hold a subordinate role in a relationship.
He said, what kind of a man will raise his hand against the woman? What is happening in that relationship? You must ask. Yes. I want to say this.
Let's take a break. When we come back, we'll continue from here. There's something called spring cleans. Once in a while, you give your system a rest. And how do you do that? You do it by eating only fruit.
And I was staying there for a while. Nobody was coming to turn me. I decided to do the turning myself. And I just turned, and next thing I had a snap. Until my father came, I told him they rushed me to the theater.
Welcome back.
Well, they are born with it and they are going to live the rest of their life with it. So
sexual problems. We often hear about these things as the major cause of troubles in homes. Husbands go out, wives go out, girlfriends, boyfriends. It's a major problem. Today we are going to look at it, and we have a doctor and a Nollywood star to look at this topic with us. Welcome, doctor.
Thank you.
And Jude, welcome. Please,
Thank you.
Anyway, introduce yourself, doctor.
I am Dr. Chitima Ajayi. I'm a family physician, adolescent health provider, and the executive director of an adolescent health initiative known as ASTRA, an acronym for Awareness and Skills Training on Adolescent Health.
Okay, it's good to meet you. Jude, I don't, whether you need any introduction, just tell us.
Anyway, my name is Jude Aurora. I'm a Nollywood actor, I'm a comedian, I'm a producer, and as well as an MC and a compere.
Okay, it's good to meet you.
Yeah.
So Chidima, let's start with you. Sexual problems. What's your take on it?
Well, sexual problems, we all know from a medical point of view, is actually a medical problem, but it's also a public health problem. It's a psychosocial problem, or they are psychosocial problems, and we have varying degrees of them, and they occur in both male and female. And like our host said, they cause problems in marriages, but we, particularly in the medical field, we see a lot of this, and it's a problem. People don't talk about these things, and we have different types. The commonest, I think I'd rather deal with the commonest, and the commonest ones we have in males. Males are actually the ones that come out, because I think it has to do with the ego and a cultural thing, and some of them don't know where to go to, so the hospital is actually the best place where they can actually confide in their doctors. And some of them, depending on who they meet, if they are comfortable with the doctor, they actually open up and tell them that they're having problems in the home. So it's left for the doctor to actually, go deeper and explore if it's the empathic doctor you meet that puts maybe himself or herself in your shoes. Now, for those who are easily pick these things up, they ask them, what kind of problems, Mr. So-and-so? They could say, well, I've not been with my wife for some years. And I'm like, are you separated or are you divorced? No, it's not coming up.
What's not coming up?
What's not coming up? And of course, you don't even need to ask. Oh, you're having issues with sex with your wife? Yes, doctor. And my wife is threatening to leave the home. And what I'm trying to tell you exactly that the commonest one is erectile dysfunction. That's what lay people call impotence. Okay. Erectile dysfunction is the commonest problem that presents in the hospital.
Around, that's what you say
yes.
around. We'll get back to you. Let's say Jude respond to what do you think?
Well, from my own perspective, the men do have the ego problem when it comes to sexual issues. So I think most of them confide in themselves. That's why you see most of them together, maybe in a pub, on a lighter mood, trying
That's why
to
they always
exactly. So they come up with those things, those issues, and most of their friends come up with some lousy solutions. Go and see this person. Go and see this herbalist. They hardly believe that medics could
solve the
problem. But I think medics actually is the last option for them once they've tried every option, and they do get distracted from families, family members who come with suggestions. Go and see this pastor, you know, you pray about it. I mean, you've not done anything medical about the issue. You are now saying go to church. God cannot help you if you have not started helping yourself.
Okay, we'll come back to that. I didn't know that sexual, that they can actually go to pastors for prayer because of that. Doctor, what do you think are those the commonest type that you see?
Yeah, like I said, erectile dysfunction is one in man. Another one they come with is premature ejaculation. Some of them tell you that before they even reach orgasm or climax, they've actually released their semen, and then the wives find that bothersome because usually it happens before they reach climax, and so both parties don't tend to enjoy themselves. And then that's for the men. Then for the women, women usually live in the closet. I don't know if it has to do with our culture. So sometimes these things are not spoken, but the ones that actually have the courage and come out, what they complain about is low libido. They don't feel like, yes, they don't have the desire or the urge to want to, you know, have sex with their partners. And then another one is dyspareunia. It's a medical term for pain during sex or sexual intercourse. Most women will tell you that they experience pain while making love with their partners. And then we have another one, vaginismus. Vaginismus is a medical term for tightening in penetration of a penis or attempt to penetrate a woman's vaginal canal. So she closes up or she feels tightened. She tightens up basically. And another one that is common too is the issue of frigidity. This one, they are unresponsive to anything sexual. They don't feel any desire, they're just like vegetables. You know, you do everything, you walk around naked, you touch. They don't have erotic zones. You know, there's some parts of people that you touch and they feel, turned on, you know, in terms of they get this sexual urge or desire. But those ones are unresponsive. There's no part of the body you could touch and could, you know, turn them on. So those are the varying types, basically.
Okay. So let's look at how well can... I don't even know.
Well, let me come in here. It's a psychological thing, right? Now, for every action, there must be a reaction, right? Now, if your spouse has problem, as in premature ejaculation and erection problem, instead of you condemning, I think it's only proper for you to correct.
So how can they live together?
Good.
So the truth of the matter, I think before we jump the gun, we should actually address the factors that predispose to this or the causes of these problems. Majority of the cause or majority of the factors that predispose to it are psychological. Majority, yes. But that is not to say that there are no other causes. Those are the secondary things that bring them up. Now, one of the major causes, structural problems. Now, people tend to have, it sounds funny, yeah, but there's some people that have a vagina, but it's not open. The vagina is not open, it wasn't, it's closed.
I'm just hearing that for the first time.
The truth of the matter is, if people with this problem don't know where to go to, they don't want to have anything to do with it.
Do they even know that they have a problem here?
Of course they do. They see their mates menstruating, but the menstruation doesn't come out. Nothing. And you know, you have people that have structural problems or congenital anomalies. Structural or congenital in the sense that it's from birth. You know, a case where you don't know if it's a man or a woman, ambiguous genitalia. Now, we also have cases where people live with chronic diseases. We're talking about hypertension, which is now a fast killer in the society. Talking about diabetes mellitus. We're talking about sickle cell disease. Sickle cell also has a special situation where they have priapism, prolonged erection, and that comes to the normality. You know, they usually have issues with the blood, so when they have that problem, the penis doesn't even come down. So it just goes there and it doesn't come down. So those kind of people also have sexual problems, yes. Then we also have issues with a lot of problems, basically. Then infections. You see, that's why we take our time to talk to the young people before they, you know, they really need to think about what they do before they, because there's so many infections you don't see. And people think that when they wear condoms, it actually stops and prevents. No, condoms are man-made, that's one. And they don't give us 100% protection. Okay. I don't know if they get to read that, but it doesn't give us 100% protection. So infections that are not properly treated could actually destroy the normal structure of, for one, the man's manhood, the penis. You know, there's a tract that comes all the way out to allow the semen to come out and to allow blood to flow. So when you have infections blocking all those pathways, one, you don't tend to have a prolonged erection, so you can't even perform. And then one, you could even have premature ejaculation and all that kind of thing. Then you could have trauma. People have accidents. You've had people that have had saddle accidents. Maybe they're riding a bicycle or fall off an okada. They hit the gutter with the side of their, you know, those things too also affect in the long run. And drugs. People should be very careful. You see, in as much as we are very traditional people, people do not know that sometimes traditional medications are actually predisposed to those problems. And even the ones that you take as a hypertensive patient, for example, if you're on particular drugs like all these antihypertensives, methyl dopa, like Aldomet, commonest ones, they take them for too long, it affects their dysfunction, their functioning, yes. And then we have people that have issues with, you know, psychological problems, and they place them on drugs for a long time. It also affects, especially their libido. Okay. So basically, things like that. Yes.
Anyway, we'll get back to the treatment. Jude, this question is for you. Some men are so into women, different women. They think that they see this as a kind of enjoyment. What do you think?
If they see it as some kind of enjoyment, I guess it's is a problem from the society where they must have mixed themselves with, you know, because
they must have done what?
Mixed themselves with the wrong set of friends, and thereby influencing them into such lifestyle. I don't really believe that a man will just wake up and decide to start, you know, sleeping around with women. There are various reasons why a man will do that. You understand? For one reason or the other, maybe when he was young, he didn't have the opportunity of being lectured, having what you call sex education. So maybe as time goes on, he will want to exploit such things and see how it feels. And indirectly, he gets used to it, and there you are. Or some of them, some of these these guys, when they are young, they do get sexually harassed, either by their house help or by one of their aunts and all that. So it grows with them, and they feel, well, this is a good way of life, you know. So they just continue. Like I always say, there's every reason to react. Yes, child abuse. There are different reasons. It's just like when you say a woman is a prostitute, there's a reason for her being there.
If I may come in, when I said psychological, yes, because, you know, by virtue of the kind of environment we live in, people are different. People tend to respond to problems differently. So we could have two extremes, you know, where someone who was sexually abused at early in life, maybe from like 10 years for a continuous time, she could decide to just hate men. So that kind of person, you expect that she would have vaginismus, you know, because of the fear and anxiety that comes with, you know, remembering the past. Or is it the person that is being beaten by her husband who has low libido? I mean, women tend to love with their heart, not necessarily with their mind.
Okay, let's take a break. When we come back, we'll continue. Lemongrass, we use it as tea. The Robos have mastered the art of using it to cook pepper soup. When you introduce lemongrass to your pepper soup, it puts people in that happy mood. Welcome back. Doctor, as we were saying.
Yes, I was talking about psychological causes. Yes. Like I said, there are different causes. One, how you respond to your partner. There's a problem at home, for example. It could be from the husband, it could be from the wife.
But people that have these problems, how can they stay together? Can they still live
Like
together?
I said, there are many ways you can. First of all, you have to come to the hospital.
For example, the man that cannot satisfy his wife. Maybe they are not even having it at all. I guess people come to me and say, for the past 6 months, I have not seen my husband's penis.
There are many things. See, as a physician, let me tell you, okay, from my own point of view as a family physician, let me be honest with you. You can't use one treatment for everybody.
Okay.
The best bet actually is to refer to the psychologist or a family therapist. But the truth of the matter is that the people you are even referring, they actually know the root of the problem. So it's about getting a trained personnel like us, because we are like the gatekeepers of the community. How many do you want to keep referring? We only tend to refer the serious cases that really need to deal with themselves, not necessarily handling issues. So what we do, we call a family conference, that both the man and the woman, and they open up. We give them the forum to open up. There's some things some women can't really talk about, but you kind of prod them to expose. Like some men don't know how to take care of the family.
Yeah. Jude, looking at it from the social aspect, what do you think are some of the major causes of this problem?
Well, it has a lot to do with guys who masturbate.
Okay.
Because while they were growing up, they never had the opportunity of making love to a woman or, having sex with age mate and all that. So maybe the only option they have is to masturbate. Now, does that masturbation, does it lead to erectile
no, not erectile. It leads to sexual problems.
There
are many sexual problems. I only mentioned the very common ones.
Okay, let's look at
masturbation.
Yes.
The masturbation is healthy. It's actually a normal physiological thing. It now becomes unhealthy. Everybody knows too much of everything isn't good. It's like adoring yourself and satisfying only yourself. It becomes a selfish thing, me. But of course, naturally, if you look at it in the healthy aspect of it, it actually prevents diseases and all that. But when it becomes too much, it's excessive. You tend to isolate yourself from the society.
So such a man would not want to
He won't respond normally.
That is where
he won't respond normally to people.
I'm heading to.
Yes,
because as when a particular guy is a bachelor and he's finding it difficult to have sex with the opposite sex, he satisfies himself by masturbating. Now he gets married. He's having a problem having to,
satisfy his wife. Or his wife satisfying him.
So that was what I was looking at.
But in some cases, you see a man, the woman is so beautiful, everything, hygiene, everything in place, yet he's running after anything in skirts. Everything is
like the way you painted that woman, she seems perfect, but everybody knows which kind of meeting they like or which kind of sleeping they like.
Exactly.
Everybody has what feeds their mind or makes their mind excited. So it's for you to just find your niche. For example, maybe that kind of person likes dirty maids.
Likes what?
Yeah.
Dirty maids that have BO.
And you see this guy good.
You'll be amazed how some men, all
even
classy,
orange sellers,
and they run after this kind of women.
Yeah,
and then you think you have a problem. You don't have a problem. They have a problem.
They get their trips.
They have a problem.
Seriously.
So, like I said, it's a thing of the mind. It's a psychological thing. So what they probably need is psychotherapy and trying to see why they do like this kind of thing and how they can actually curb it.
But if a woman should find herself in such a situation, what do you think she should do?
She should move on. She should move on.
Wake
Thank
up.
God.
It's not you that has the problem. He has the problem.
Seriously. Why do you think most men do sleep with their housemates?
Because they like it.
Sometimes it's their flavor. That's their flavor.
Let's take a break.
That's their flavor.
When we come back.
You see, Nyanya's like, what's the flavor? That's the flavor. It's crazy.
What do you have to say about this case?
Why people who are not circumcised may have a higher incidence of HIV.
Welcome back to this exciting topic. Jude, I'm coming to you straight.
Okay.
What are those things that can enhance sexual life?
Yeah, I seriously believe that the couples should be able to encourage themselves. About outside seeing a psychologist.
But if the guy likes a dirty maid, what do you do? Because it abounds in our environment.
No. If your left eye causes you to sin, cut it off. Okay. If the wife knows that this is what my husband likes, then it's now left for her to change
like
the orientation of the husband.
If it will help.
You understand?
Okay.
So if the maid is still there, off. Then send the man.
So the doctor can't pick up from there.
Exactly.
Okay, the remedies.
Yeah.
Well, coming from my own point of view, like he said, first things first. If you have a problem, seek help. That's first. And if coming to the hospital make you think you get solution, the doctor, of course, has certain things he needs to find out. Since you have different causes, he's going to actually investigate to ensure that you don't have any major cause. Like I told you, it could be psychological. He has to rule that out first and then ask you to do some investigations. And then, of course, he's going to explore other areas that, for example, your lifestyle. Okay. One, he's going to ask you about your family, your work, how you're coping. Some people are really stressed about work. That, you know, you come home from work, hard days, you leave at 6, come back in the evening. I tell you, I don't think any man in his right sense would want to, you know, meet his wife. You know, they always tell you that they're tired. And then secondly, or rather thirdly, you could address other lifestyle, reduce smoking. In fact, stop smoking, there's no benefit actually, apart from your own kind of, you know, excitement you feel at that point, but it has more disadvantages than advantages. Alcohol, I'm not going to say stop, because research has shown that a little bit of alcohol is actually protective. It protects the heart. We're going to talk about that one. But I would rather you stop, because, you know, like we said, we are different beings. The way my body would consume alcohol is different from the way you would. Some people smoke for 50 years, they don't have lung cancer. Others, in fact, 2 years experience, they're down. Okay. So, like I said, it's better you don't, there's really no benefit in these things. And then eat healthy. In case you do not know that, another cause, which I did mention, of all the sexual problems, fats. When you're obese, you know, and cholesterol is high, people should have this mindset of having a body check, a physical exam done. It doesn't take anything really. Nobody's going to ask you. You shouldn't think about the cost. You should think about, you know, the cost effectiveness, more like it. Like in the long run, you're going to like have more years to your life, you know. Of course, naturally, we have to think spiritual, but I'm just telling you the ones we know. Eat healthy, and eat less fats. Exercising is so nice. It's not about hustling. Some people think that it's about rushing to the bus stop and, you know, going up and, no. You see, there's bad stress, there's good stress.
Intercourse is also exercise.
Well, if you want to see it that way, but you can't, I don't think anybody will be waiting for you to have a mating every day, every second. Come on. You can burn your fat somewhere else, but not like that. Come on. You know, so exercise, like having prescribed exercises. I'm not going to advise anybody just like that. If you have a history of hypertension, or there's a history of hypertension or diabetes in your family, please go and do a check. There's a likelihood that you probably would inherit that problem. So the earlier you know, the better for you. And if you're hypertensive, it doesn't mean you can't exercise. There's something called prescribed exercise, like I said. There's certain exercises they ask you to do. There's the commonest one, which of course, maybe with time you get to know, it's called coconut. Everybody can do that. You just move your arms and swing your arms from left to right, bend up and down. You can do that as many times as possible. Everybody can
coconut.
do that. Yes, the way it's spelled. You just put your hand side, and then O, and then N, and you know, that kind of thing.
This one is apple.
You know, but the point is living healthy. If you live healthy, address your areas of stress, you won't have as much problems. And then communication. You see, seeking counseling in different aspects. You could see a psychologist to help you deal with your personality problem. If you are the kind of guy that likes dirty women and women that are smelly, go and see a psychologist. If you're the type that you respond only, if you're a man, you respond only to men. So that's basically seek counseling, be healthy, eat well, don't smoke, don't drink, sleep when you're supposed to sleep, don't deny your body of sleep. That's the truth. When your body is exposed to a lot of stress, you cannot respond sexually. You must be an animal if you are.
Okay. They say that men respond to what they see. So in what ways do you think that the women are contributing to the man
I think we need to hear that.
going out? Do you think the women are contributing to the man going out? Because since men
Oh,
respond to what they see.
Before you even get married to the woman in the first place, what attracted you?
But the man himself has changed.
What
Over the
attracted
years,
you?
the man himself has changed.
And the same goes for the lady, because there are two sides to a coin.
So
Now, I see a beautiful girl, I like her. So, physically, first. That's the major attraction, right?
Lost at first
Now,
sight.
that's lost. No, I agree with you. Don't worry. I won't disagree with you. Now, you get close to the lady, you're friends. And in between the time you start your relationship and the time you now grow in love and say, okay, you want to marry this person, fine. The question is, why is the lady not maintaining that same
is the man himself maintaining that same stature?
Good. A man has 6 packs when you marry him. And by the time you marry him, you overfeed him, he now has 6 tubes. What do you expect?
Still on the woman's
You will not change his name to Belemaya.
I think the most important thing is communication.
It is.
The problem
Seriously.
with most couples
See,
is
I
that
actually believe that. Sorry
no
to butt in.
problem.
I actually believe that for you to have a long-lasting relationship with your spouse, you have to really, really understand yourself, inside and outside, however you want to see it. So communication also counts.
very important.
That communication, if it breaks off, then the psychological issues come in. That's just the basic truth.
Like the vaginismus. Let me
Exactly.
it's coming out now. Some men rush to have the sex. They see the women as sex slaves. They don't even engage in foreplay.
Please hold it. We'll come back. We'll come back to that. Let's take a break. There's something called spring cleans. Once in a while, you give your system a rest. And how do you do that? You do it by eating only fruit. Welcome back. Doctor, please, let's come to you. Some women, when they have, after childbirth, they seem to have a dysfunction, maybe their body is not good enough again, or maybe the husband too can even have a problem, like, is it psychological problem or what? What do you think?
Okay, I think I understand what you're trying to say. You know, most women, after childbirth, your body has just come out from stress. Most men, because they've been starved for so long, as soon as the baby has popped out, they just want to go straight and, you know, I beg, you've been starving me, you know. And some women are not psychologically ready to engage in any form of, you know, intercourse. So they need some time for their body to heal, which some men don't have. Nigerian men don't have patience.
Some.
Okay.
Please.
But can the woman actually have intercourse at that time?
Yes, she could if she's ready. Like I said, it's all about psychological readiness. If she's ready to, you know, go ahead and have fun with her husband, fine. But some are not, because really the body needs, I mean, imagine a woman who has popped a baby out of her vagina and it has been caught, you know, the episiotomy they usually do, and you come home with a baby all healthy, nice, and the next minute, wound is fresh.
And the pain is still fresh.
Exactly.
Pain is still fresh.
Exactly. I think the men need to be schooled about it.
Oh, please forget schooling.
hold them.
We've been talking about this for
Yells, they
20
should be
years.
schooled about it.
I don't know about
Yells.
it.
No, I'm
Nigeria.
It's just some. What's your final thought on this issue?
Well, for me, a lot depends on the understanding. You know, you should be able to understand your partner very, very well. And for you to understand your partner and also respect your spouse, there should be that understanding, right?
Okay, so
now, the basic thing is between the man and the woman, that communication must be consistent. And there's that communication between the man and the woman is very, very
because
vital.
once the man goes out,
is key.
If you have a problem, just come out and talk. The earlier you come, there's always a solution for this problem. There's always, it's very rare you get surgical
is there any case
treatment.
that the organ does not work at all, no matter?
Yes, they're different. Like I said, trauma Yes, and there are cases like that.
When they were married, they were okay. Then later, the man cannot perform at all. There's nothing to
But
be
it
done.
can be helped. That's what I'm saying. There are drugs.
That's what I'm saying.
Psychological treatment is there. You go and see, they'll give you psychotherapy,
It can
family
be helped.
counseling. Yes.
Yeah.
That depends on the different stages too.
Okay.
To this kind of things. The longer you stay away, the more, you know, the mind and the body work together.
For every
It will
problem,
be
there must
making
be a
you
solution.
depressed.
Okay.
You'll be so depressed, and the more depressed you are, it don't allow you to function as a man too.
Okay. Where are the places that one can go for such?
Oh, hospitals. Always come to
Only
the hospitals.
hospitals
Yes, and of course, when you stick, I cannot say go and do traditional.
Doctor, is that your final word? Do you have any other
Final
pieces?
word, take care of yourself, live life properly, keep off from bad friends that give you wrong advice, to go to wrong places, seek help when you need to seek help, and address all areas that give you a form of stress in your body. That's just it. There's a
what you
remedy
have to
for
say?
it.
Communication.
Communication, okay. Thank you so much for coming. I really appreciate it, and I really, really enjoyed it. I hope you'll come next time.
If you invite us.
Of course, I will. Jude was
welcome.
really...
Anytime.
Jude
Most
is
welcome.
always cracking me up here. Thank you, Doctor. I really appreciate this. We'll be right back. Medicine in your kitchen. Yeah, what you eat. I keep saying, this is bitter leaf. Like you see me, see what I'm doing. I cut it and I'm squeezing it. It's a lifesaver, anytime, any day. The thing is that you never know where life will take you to or the circumstances of life. So it's good to know this first aid, the remedies. You never know who you can help at any time. That's water. What I did was just a handful of bitter leaf, squeeze it very well. You never know where you need this thing. It is #1 first aid to any stomach problems. Before you buy time to go to the hospital or anything, you have this at your backyard. It grows almost everywhere in our country. Your backyard, just cut the stem and put in the ground. It will grow. The bitter one. It is a lifesaver. Bitter leaf with ephedrine you mix together with ugu. It is the #1 medicine for a diabetic. So, stomach problems, count on it before you get to the hospital. Thank you so much. I hope you had a nice time and I hope you enjoyed it and you have learned a thing or two. See you next week. Thank you for watching this program. It is such an exciting topic to me, and I hope you enjoyed it. Keep a date with us next week. Bye for now.